I got my voice back, so I think I can yell enough today.
It's up to you if you want to use that or not.
I'll poll the audience. I usually have a very carrying voice. People usually tell me to knock it down some, so.
Yeah, last time people couldn't hear. There were
Oh, really?
many people at the vaccine one.
Yeah.
I think you were on call that.
Yeah, I was. We're live. We're here. We got 3 minutes till showtime.
Where'd you go to school?
Ohio State.
Yeah?
Yep. Much to my family's chagrin, they're Michigan fans. And then they had to pay their tuition to Ohio State for a solid 4 years. There's a little bit of payback, I think.
I'll bet football games were quite interesting at your house.
They are. They're very fun. They're still quite spirited. Half of my family is Ohio State people. The other half is Michigan people. So, yeah. For Christmas, I bought them one of the house divided flags. They fly it proudly, so it's all good. It's all in good fun. Yeah.
Hello everyone, good morning. Thank you for joining us here at Big D's for our anniversary sale today. Welcome Dr. Vicky Johnson here, who's speaking on our equine dentistry. This ought to be a really cool, looks like you got some great things there to present to everybody. So take advantage of some great deals today. Listen to some excellent things about equine dentistry. We all love Dr. Johnson if you've used her before with Cleveland Equine. So take it away.
Thank you. I'm going to try to use not the microphone, but if you can't hear me, I will happily use it. So can everyone hear me okay? Great. Okay. I'm also getting over the world's worst cold, so I just got my voice back. So if it stumbles, forgive me. But if it starts to fail, I will use the mic because I know you're all here for that. So when Big D's, we do these seminars obviously every year, so some familiar faces. You guys have been to a couple before. But when they asked me what I wanted to talk on, there's kind of some hot topics that run through your head in terms of different things that people are talking about, things that I always get questions about. And dentistry is kind of one of those things. And so I thought it was really fitting because this is also the time of year we're starting to do our spring shots, some of that stuff that dentals fit in the mix. So I wanted to go over dentistry. I am one of 3 practitioners at the clinic that do dentistry, myself, Dr. Rangel, and Dr. Cuttrell, who's now Dr. Sabo. She got married. So if you've met any of us before, what I'm going to talk about today, I just want everyone to understand it's kind of a personal style. So the 3 of us practice dentistry pretty similarly, and I'm going to go through the ways that we do things. Some of my colleagues and even boarded equine dentists who are veterinarians that only do dentistry do things a little different than this too. So the fundamentals are all the same, and that's what we're going to talk about a lot today is fundamentals. But I'm going to give you just a little peek behind the curtain in terms of what I do specifically. But I just want you to know if you're like, well, the person who does my dentistry doesn't do that, it might be a little bit different. So I kind of have a bit of an agenda because dentistry is a complex field in terms of the very basic of it is anatomy. And just like most things in horses, lameness, even when we're working up a colic, you have to understand the anatomy. Horse anatomy, in terms of their dental anatomy, is very different than your cats and dogs anatomy, and so I want to spend just a little bit of time boring you all with that. And then we're going to go over kind of the meat and potatoes. So what we look for in an oral exam, what constitutes a horse's float, and then some basic kind of traipses into some different pathologies that horses can have and things that we're always looking out for as part of the horse's annual dental. And then finally, I just have a couple of quick little myths that I like to always debust or debunk with people when I'm there at their dentals because people love to ask questions, and there's a lot of stuff that goes around on Facebook that I like to kind of just put the kibosh on. So the first part of understanding dentistry is understanding that horses, I think all of us are well aware, are grazers. They eat forage and roughage. So their mouth over years and years has been developed to do exactly that. And I think sometimes we kind of downplay the importance of horses' teeth and their oral health because you know, the basic of their existence is turning grass into manure, right? We're all aware of that phenomenon. And so to get there is kind of a complex path that involves the horse's colon and digestion and fermentation. But when that hay leaves that stall floor into the horse's mouth, the teeth are the first stop. And so their job is very specific in terms of getting that forage down to a size that's digestible. Now, I'm sure you guys have all heard like about cows and how they ferment their food in their four stomachs and the bacteria that do that. Horses are kind of an in-between between you and me and a cow. So they only have one stomach, they don't ferment there, but they do have a really robust colon. Now, some of us are pretty aware of the horse's colon because we've all had a colic or two, right? And a lot of times that goes back to that organ not doing its job. But the colon is a very sensitive place for horses because that's where they ferment all of their food. So they have bacteria that live in their colon, and their job when that feed material comes in there is to munch all that fiber down, and those bacteria are actually what's providing your horse with most of their major nutrition. So a lot of horses can't digest and pull out some of those major nutrients from their feed. The bacteria do that for them. So if we're not getting that hay particle that starts, you know, this long down to the colon to about that long, then they can't digest it. So I think this is like something that I talk a lot about, especially when I'm seeing my senior horses that maybe don't have ideal dentistry, talking about how we can manage this to make sure we're still fulfilling that need that feed enters the colon at the right size. Horses are also very different in terms of the fact that they have what we call hypsodont teeth, which means tall crown. So hypsodont animals essentially are born. You're good. Come on, you're fine. Hypsodont animals are born with dental buds that over their life then turn into their adult teeth. And their adult molars, I'll turn to my lovely specimen here, their molars are very different from yours and mine. So in the horse's mouth, when they are just existing, you only see a very small part of the horse's tooth. So here you can see the crown is only anywhere from a ½ inch to an inch long. And obviously this horse, you can't see its gums and things, which covers up even more of the tooth. So their tooth is almost like an iceberg. You know, an adult tooth that is outside of the skull can be anywhere from 4 to 5 inches long. And so over the course of that horse's life, once the adult tooth is in, it's going to slowly drop down into the mouth, and simultaneously as that horse is eating and chewing, it's going to grind away part of their teeth. So their tooth is actually on a constant track into the mouth, and then as they chew and they grind some of that away, that's why we have to come and see these guys every year. And the tooth that I see today is not going to be the same part of the tooth that I see next year. That tooth erupts at a rate of about ½ centimeter a year. So it's kind of crazy if you think about it, that actually will come down over time, and then we're not seeing even the same parts of the tooth year to year. And we'll talk a little bit more about that here shortly. Not all of their adult teeth are even present until they're 4 years old. So horses, again, because they have to be able to eat forage pretty quickly in the wild to survive, they have their baby teeth, or their caps. They're around until they're about 4 years old, where they've shed all their caps and now all their adult teeth are in wear. So the mouth is a very dynamic place, which is also why we see these guys more than just once every couple years for their dentals. They also, it's important to know that when they get older and that tooth has then erupted down their entire life and then been ground away, our older horses have shorter cheek teeth, so they're molars. And you made the comment when you're sitting here about the incisors. The incisors don't erupt the same. So those teeth are more like your and my teeth. Once the crown is out, what you see is kind of what you get for most of their life. And they will change angle, and they can change in appearance, obviously, because they do grind down some, but they're not exactly the same where we see as much, you know, grinding and eruption as the cheek teeth. Okay, so the next most difficult part of dentistry is talking the same language. So we as veterinarians use kind of a different language to describe the teeth than you know, as a common person would, because it can get quite confusing quite quickly. So if you look at the horse's skull, I'll try to reassemble here. Okay, so this horse is facing you all, if you look at the horse's skull, we break it into 4 quadrants. So one of the technical kind of anatomical terms you need to know is midline. So if you draw a line straight down your body that cuts it perfectly in half, that's your midline. So same thing to this horse. If we draw a line straight down the middle of the skull, that's its midline. And then we break it into 4 quadrants. We number those quadrants, the 100s, 200s, 300s, and 400s. And so we start on the upper right as the 100s, the upper left is the 200s, the lower left is the 300s, and the lower right is the 400s. And so the reason I'm kind of giving you this basic understanding as to the nomenclature is because this is how we refer to the teeth. So if you look at this diagram, and this is if you imagine you're looking straight at the horse here, this dotted line represents midline, and then we've spread all the teeth toward you. These are the incisors here in the middle, 1, 2, 3, and then it goes all the way back into the cheek teeth. So this is the last tooth in the horse's mouth. So horses, does anybody know how many teeth a horse has?
36 or 39?
So we've got 12 teeth per arcade times 4. Yeah. So not all horses have all of those teeth. Some horses will be missing their canines or their wolf teeth, as I'm sure some of you know, or if we take them out, then they definitely don't have those. But we number them starting from the midline, and then we go down each arcade. So for example, the upper right quadrant is the 100s. So we start with that incisor that's right up against midline, which on this guy would be this tooth right here. That's 101. And then as we go back, we have 102, 103. The canines are the 04s, so 104 if you're on the top right. And then back into the cheek teeth. Now, not all horses have the same teeth in their mouth. Canines, for example, the ones that you see right in that gap where you put your bit in, that's usually a tooth you find in geldings, although not all geldings will have them. We think that was kind of like used as a fighting tooth, so more for the stallions, the boys. Some mares will have them, some geldings won't have them. So it's one of these things that it's a little variable. Same thing with wolf teeth. So just important to know. We're making this PowerPoint available, so a couple of these slides like this one, I typed that all out so you can review it later, but I'm going to breeze past this because I just said it to you. So now that you kind of know the numbering system, then we have to talk about the actual anatomy of the tooth itself. And the reason this is important is it changes the way that we can perform our floats, and it changes the way that we treat the tooth over time. So if you look here on the left, this is another term that I'm going to use a lot that I want to explain is the word occlusal, or the occlusal surface. So occlusion is when the teeth touch one another, and so the occlusal surface is like the tabletop of the tooth. So the part that they actually touch each other with, and the part that they chew their food. So this is the occlusal surface here, or the surface at which you see inside the mouth. And then on the right, this is a tooth that we're looking at from like the side profile view, and then here, even more to the right, they've actually sectioned the tooth in half so you can see the contents on the inside. So it's important to know this because our teeth are just a tooth of enamel. So if you take a tooth out of your mouth and look at it, it's just a whole wrapped in enamel. That's all the tooth is. Horses' teeth are actually multiple layers of dental tissue that are like a Chipotle burrito. They've been wrapped in layers, and so you can see different parts of that tooth, and I'm not going to dive into this. I could give you a whole hour talk on just the anatomy of the tooth, but there's layers of enamel, there's layers of dentin, there's layers of cementum in some parts of the tooth. There's the pulp horns, which are where the vein, artery, and nerve live that supply the tooth, and so all of those different structures are shown on the surface of the tooth in the horse's mouth, and so those tissues they don't all act the same, and we can't treat them all the same. So it's important to understand the anatomy when you're going to treat a horse's mouth, because if you don't know that and you're working on parts of the tooth that are not meant to be disrupted, it can be disruptive. And so the important part that I point out to most people, and what I would say is kind of most important when I'm doing a dental, are the pulp horns. So has anyone here had a root canal? Yeah. Okay. So what was your experience with a root canal? Give me a fun, not fun. Not fun, right? So he's like, fun when I got the sedation. But so a root canal is when they actually, whether you have a cavity that's eroded into that pulp canal or the tooth has died or something that want to take away feeling, they enter that pulp horn and disrupt and take out the nerve so that the tooth loses feeling. So if you imagine starting a root canal where your dentist is in there and opens up the pulp canal and says, well, actually, I think I have lunch plans, I gotta go, and leaves it open, that nerve would be exposed to your mouth and be a nerve still, taking in information, sensation, feelings, and would have no protection. So horses, and I'm going to switch sides here just so I can point to things, but horses, and I think I'll try not to block you all, those pulp horns, that's what the red arrow is pointing toward here, these kind of pink streaks that come down the tooth. They have a pretty cool protection mechanism against that pulp horn being exposed. How many of you have cats or dogs? Good, so this will hopefully make sense. How many of you trim their toenails or at least know what their toenails look like? Great. So you guys know what the quick is, right? And you know if you cut into the quick, it bleeds and then your pet's really mad at you. Same concept. So the horse actually has what would be akin to the nail or some enamel that fills in, it's actually dentin, but fills in over top of that sensitive pulp horn and protects that from the environment in the mouth. And so that dentin sitting on top of that pulp horn is the protection between that very sensitive nerve and the world. And so just like a dog or cat, if you trim that really short and expose part of that dentin or take away its natural protection, then they'll feel sensation there where they shouldn't. And so that's important to know because we'll talk about this when we talk about some of the pathologies and overgrowths and things. If you're too aggressive or taking away too much tooth, you can enter the quick on a tooth. And it's very much the same as you've experienced with your root canals. It's very much the same that your cat complains when you cut their nails too short. So that's just important to know, and that's why when you talk to most veterinarians, whether it's about legs, colons, teeth, the anatomy is at the basics of everything we do. That's why we spend, countless hours in school just going over this, because you have to understand that to understand what's going on inside the mouth. Also, a professor in vet school told me this once, and I don't think I really understood how true this was until I came out and practiced. You have to understand normal to understand abnormal. And so I put this x-ray up here on this screen because if you looked at this, you'd be like, wow, look, this horse has these big points, and those have to be really sharp and hurt the horse. But what you have to know is that that's very normal, right? The horse has to grind. Would you grind better with a rough surface or a smooth surface? Rough. So they actually have these ridges that are very normal in their mouth, and if we go back to our dental exam, you can see that there, how it kind of has that waving pattern. So those are actually there meant to give the horse some traction to grind that food really efficiently. And so if you just look at this and you didn't understand, you can even see the bottom teeth have kind of corresponding ridges to where those are, or grooves. So it's like a groove and tongue system. So it's pretty neat, and this is why, too, you have to understand the anatomy, because you could go in and say, oh, this horse has all these overgrowths because it's chewing weird. You could flatten that whole tooth, and you'd be doing the horse a massive disservice. So that's kind of the basics to anatomy, and then that's the foundation to our oral exam. So I know I have a couple people here who have done your horse's teeth before. So you know that the first thing that I do when I come for a dental appointment is usually I talk for about 20 minutes because I'm really good at that, as my poor tech is like scurrying around unpacking things. And then the first thing we do is do the horse's physical exam. So we always, if we're going to sedate a horse, we always, listen to their heart, lungs, take their temperature, things like that. And then we sedate the horses. So I'm a big proponent, and I know we could get into a conversation about this, about sedating horses. When you hear me talk about an oral exam, I should have brought it in, but I have a mirror that I use for my oral exams. It's 14 inches long. Have you ever tried to put something 14 inches long into the back of a horse's mouth? I'll give you a spoiler, they don't love it. So if a horse isn't adequately sedated, you're fighting them the whole time to get their tongue out of the way and try to get them to stop chewing on everything. And so we give these horses what I would say kind of an above average sedation dose, because we want them nice and quiet for this so that we can get a great look around at their gums, the surface of their entire tooth. And that's my oral exam. So the first thing I do when I do an oral exam is I kind of step back and just look into the horse's mouth and see kind of what I see. Like, what's the general general profile. Are the teeth where they should be? Are the teeth, do they look the way they should? Are they black and grass stained because this horse is out on pasture all the time? Are they like this horse where, you know, you can see without even looking at the fact that my mirror's in the back of that horse's mouth, this tooth up here is pretty tall. Why is that? You know, like I'm looking for kind of the beginnings of things that I'm going to dig into as I work my way through that horse's mouth. I look at the tongue, we look at the teeth, we look at the palate, I'm looking at the lips, I'm looking at all the gingiva that covers that horse's mouth. You know, there are little things, and the more I do this, the more I'll find things that I'm like, oh, that's where that is, and because of this, because of that. And so I start to just try to write the story of that horse's mouth. I'm a huge believer that the mirror exam is the most important part of a dental. So taking that little mirror, it's the same mirror the dentist uses in your mouth, it just happens to be about twice the size and on a 14-inch pole, and we go all the way down all of the teeth. I look at the sides, I look at the occlusal surface, I look at the gums surrounding everything, I look at the tongue with it. If you don't have a mirror, you can't see the horse's entire mouth. You're just getting the general kind of gist. So that's a personal little vendetta of mine. We now also have some pretty cool tools. Instead of a mirror, I've got a camera. So this little device here is called an oral endoscope. So if you guys have ever had like airway work or stuff like that done, you know we have flexible cameras that we can actually put in the horse's mouth, or in the horse's, you know, nasal passages and things, but this is an oral endoscope. So this is about how long my mirror is, and so this plugs literally right into this exact same laptop I'm giving you this presentation on now, and I can do this at the farm stall side. So you can see the little cameras here at the end. It's got a really bright LED light, and I can go all the way down that horse's mouth, look at the bottom, I can just sit around and look at some things, and get a pretty comprehensive picture with this. It's right up at my face level, so usually I park my laptop right next to the horse's head, and I can just look at everything right there. Especially like this horse was a horse that I saw 2 weeks ago. You can see obviously this tooth is fractured. It's missing its other half. It's got some feed packed in there. This horse was there for an extraction, and so that tool is really nice for that part of the exam, because as I'm taking this tooth out and working my way around it, I can just be right there with my camera watching the whole thing. So it's like a really fun live stream if you love dentistry. So luckily for you guys, dentistry is just a lot of pictures, so I have lots of photos. All of these, except for a couple, which you'll see I've cited, are photos that I've taken. So if you see a horse featured in this, congratulations. I tried to remove all identifying characteristics, but so this is kind of what my oral exam looks like. So when I first look in, what I do is I literally take my little fingers, usually I have gloves on. You can tell it's me because I have the same two freckles. And I just take my thumbs and I literally just kind of spread the little cheeks open and just take a look right down the mouth. And so this is what I'm looking at, is what is the characteristic of the arcades. You know, again, I'm just taking a big once around look in the mouth before I start getting in deep. Things that are important to catch on your oral exam that if you're not paying attention you can miss. Does anybody see what I might be looking at in this photo on the right? You're like, oh, we didn't know this would be a quiz. And also the TV's really far away.
Is there a broken tooth at the top?
This guy?
Yeah.
Close, it's a wolf tooth. Yeah, so it's a wolf tooth. So this is a young horse that I was doing, I think a 3-year-old riding horse that we were doing a dental on, and it's got a wolf tooth. So nothing that crazy, but a lot of times, especially if you get going fast, you forget to kind of catch those things and mark them. So yeah, that's a wolf tooth there. So again, part of the oral exam, we're seeing what teeth are actually in the horse's mouth. We're looking at the palate. So I know this is a super zoomed in photo. It's kind of the best way for me to get pictures while I'm in the mouth. But this is the horse's tongue here on the bottom. And this is actually the horse's soft palate. So you can see the hard palate here with all the ridges. But this is the horse's soft palate, and he's got a little ulcer there. So this ulcer is kind of quiet and healing. It's got some nice borders. The tissue is nice and pink. But it always raises the question, like, why would this horse have a giant ulcer right in the middle of the soft palate? Have you noticed anything? Did the diet change? You know, maybe we need to come back in a month and check this to make sure it healed. Again, it's just things that we catch with this. And then on the right, do you know what I'm taking a picture of there? Yeah, there is feed pack. Do you know why? I'll give you a hint. It's the stalagmite.
Yeah, I'm looking at, that's not the wolf tooth.
No, and again, I've done you a disservice by zooming way in. That is,
For a point of reference.
yeah. So this is the tongue here. this is the soft palate, and that's like down into the horse's pharynx. So this is the very last molar on the left lower side of the horse's jaw, and it's got a big ramp. So that little point sticking out there, and you can actually see it's worn an ulcer in to the horse's, what we call the palate-glossal arch, right? So this is my dressage horse that won't get on the bridle. And they say he just won't break at the pole. I wonder why. When he breaks at the pole, that point goes right. So this is, again, just all like first glance I can catch this, then we go back at the mirror and characterize it, and get a great idea of what looks like what, so that especially if we're working on a riding horse, that I'm there because you're having issues, you know, I want to know if I correct this appropriately, does it correct your problem? Are there other things? You know, the ulcerations can be a big problem for these horses that are painful. If you've ever bit your cheek really good, you know how that feels. Another good one, you know, part of your oral exam, the horse had a pretty massive point on one of his lower cheek teeth, and every time he chewed, you can see he's got a smaller laceration there, a big laceration there, and he had worn a pretty big ulcer on the side of his tongue. So these are simple things that, like, if you had just, you know, gone in and done a quick float, you could have missed this. And even though, like, you may have addressed the problem, this horse was really painful and having trouble eating. I don't blame him. So, like, we could give this horse medications to help with his tongue while that was healing over, since we got rid of the inciting cause, which is the points. So now kind of into the fun part, which is the float itself. So the technical term is odontoplasty. So we're actually taking away parts of the tooth. So that's odonto is tooth, plasty is remove. And when I was in school, you know, it's one of those things where you're afraid to ask somebody. I was like, why do we call it a float? Like, what, you're not floating anything. Like, the horse is not bobbing down the river. And I don't know about you guys. I'm not a skilled brick mason by trade. So I had no idea that float meant to smooth. So someone, I don't know, Dr. Jack Easley is a boarded equine dentist. He's kind of the father of modern equine dentistry. I went to a meeting with him about a month and a half ago, and he had said this, and it was like, light bulb. So it is a masonry term. So, you know, when you float things in construction, it means to smooth surfaces. And so that's exactly what we're doing. So we use files to remove those sharp enamel points and essentially smooth out the horse's teeth so that they're not, you know, disrupting the rest of the tissues in the horse's mouth. You'll notice I use the word targeted treatment. So the parts of the tooth that are safe to float is some of the excess enamel. You know, those layers are there for a reason. They protect the tooth, they protect the sensitive structures. So we're really only working on certain parts of the tooth at a time. We use a lot of different tools. So everyone always, another kind of hot topic when we talk about dentistry is, you know, power tools and hand tools and stuff like that, which I have another slide on that. But all of our tools are some variety of a grinding surface. So this is a hand float on the right, or on your guys' left. It has a carbide insert, and it's got a kind of rough edge, and I'll pass this around so you guys can feel it. But this is a hand float. This is a power float. So it's the same, it's a different material. This is actually a diamond burr, but we've shrunk it down. This is called a disc float. So I have a second one that's a different shape, called an apple core, because that's what it looks like. But these are motorized. So this is on only the finest Milwaukee hand tools. It's got a light and it spins at a high rate of speed. This doesn't hurt. I can sit here and do this all day. It does generate heat, so like if I did hold that on, I would give myself a thermal burn, which is also why it's important to know your equipment. You know, we're floating. We only work on a single tooth for a couple seconds because we can do thermal damage to the tooth itself. But when in the right hands, you know, these are just as effective and they work really well. So I'll pass this around. I'm not going to pass this around because it's my child, but if you want to play with it, you can come up and give it a hold. And since I have a whole strap and package of these, we'll distribute a couple. So you'll notice out of the ones that are coming around, they're different sizes, they're different angles, so they make tons of different hand floats that are different angles for different things, just like most tools. So we recommend, and the AAEP, which is the American Association of Equine Practitioners, which is kind of my governing body, recommends that all horses have a sedated oral exam every 12 months. And so that's kind of the gold standard. That's the rate that we've established over all of our research in teeth that most of these points are going to reoccur. Now you're probably like, well, why do the points reoccur? Well, we've already talked about the fact that those teeth are constantly erupting and being worn away. And if you imagine if you took two squares and rubbed them together long enough, you're going to sharpen the edges, right? So that's why we recommend doing this every 12 months. And you'll see sometimes we change that recommendation, but 12 months is kind of the gold average. So the next important part about the float is where we float. So in horses, we float the outside of the upper teeth, the cheek teeth, and the inside of the lower cheek teeth. And you're like, why is that? Well, I have stolen this lovely head CT image from the University of Wisconsin that I've cited. But I've stolen this head CT because I think it points it out really well, which is the horse's mandible is actually narrower than the upper teeth. So you can see even in the skull, the upper teeth sit in a neutral position outside of the lower teeth. So because of that, sometimes these lower the outsides of the upper teeth and the insides of the lower teeth don't come into as much occlusion or rubbing as the rest of the tooth during that horse's chewing cycle. And because at rest, these are sitting kind of outside of occlusion, meaning not touching their kind of partner tooth, this is where they'll develop points. The other reason is the shape of the tooth itself. So this is a diagram that we use for like recording different like pathologies, but up at the top here we have the 100 arcade. So which corner of the mouth is that? Upper or lower? Upper right. Thank you, guys are great. So this is the upper right, and then we have the 400s, which is the lower right. Yeah, 1, 2, 3, 4. So we have these two sets of arcades, and you can't see this because it's a little small, but the top of this is the buccal aspect, or the side closest to the cheek, and down here on the bottom part is the lingual, meaning the side closest to the tongue. If you'll notice, look at that. They naturally have these kind of grooves and waves of enamel and dentin there. And same thing on the bottom, you'll see the groovy side of the tooth is up against the tongue. So not only is that part of the tooth not in perfect occlusion with the tooth above or below it, same thing on the top, but it also has the shape which predisposes them to getting those enamel points. So that's why we float the surface of the tooth we do. Now if I'm doing your horse's dental and I go in there, because I always kind of hand check when I'm done to make sure I like the feel of everything, if the horse has some prominent enamel, maybe on the outside of the tooth, of a lower tooth where we don't normally go, yeah, I'll kind of gently float it down so that it's not bothering the horse. But otherwise, we focus to just the outsides of the uppers and the insides of the lowers. So even small points can cause big disruptions in the horse's mouth. If you imagine, has anybody ever got a filling that the dentist didn't get to fit just right? It is minuscule, and if you say to them, the filling's not right, they go, it looks fine. You say, the filling's not right. You know that just that little change on the surface of your tooth can change the way that you chew and the way your teeth even just sit together. So horses, it's the same thing. If they have these large points, and you I think you yelled in the back about when I pointed out that big point sticking out to the bottom of the tooth, you said, oh, there's food packing. Horses, shockingly, are not simple creatures. If they recognize that that's painful, they're going to push a whole bunch of chewed food over there to try to buffer that so that it's not painful. So that's why it's food packing, not necessarily because of the point, but because the horse recognizes pain and they try to literally pack around it. So these horses will oftentimes pack feed. They will chew with one side of their mouth versus the other. They will not do, a normal horse chews in kind of a figure-8 motion with their mandible. They will just chew either straight up and down, or they'll grind halfway and stop. And you can see here this picture on the left, which is again a little tough, but I'll use my little endoscope as my pointer. This kind of brown patch here in the side is actually an ulcer that horse has worn into their cheek as they've been chewing, and there was a point on the side of this molar right here. So these guys can have, even these small little enamel points can have big implications in the horse's mouth, which is why we recommend doing them once a year, because we can get ahead of this. And my favorite dental is one that I know I did a calendar year ago. I open the horse's mouth, there's very mild points, I do a quick float, and we're done. And everyone's like, well, that was fast. I'm like, I did such a good job last year. But really, you can stay ahead of these pretty effectively and keep the horse's mouth comfortable so that you're not coming back and saying, oh, well, even though we floated him 3 years ago, and now this has come back, and now he's got, a big ulcer in his cheek or whatever. Yes? I'll get to that, but more often, yeah. So reasons that you should pursue an oral exam. Obviously, I just said the average is 12 months for an adult horse. For a young horse, age 3 and under, we actually recommend doing them every 6 months. The reason for that is as they're shedding those caps off, which they'll do up until some horses 4 years of age, as those adult teeth start to come down and they're not exactly in wear, meaning they're not in the enough length to be touching their kind of partner yet, their mouth changes very quickly. And so we do them every 6 months because it's not uncommon that as things start to come into wear, or if there's a retained cap that we need to remove, that can happen within the realm of a couple months that we address them sooner. Horses that have significant disease, so overgrowth, diastema, which again, I'm going to say a lot of words that you're like, we haven't talked about that yet. We're going to. We will want to see those horses more frequently. So if they've got a big, long hook in the front of their mouth, I can only take that down so much every time I float it without risking to get into that pulp horn. And so because the horses, shockingly of all things, are at least good enough to do this for us, they will, if I take a hook and I float down a little bit, and then that horse leaves his dental and starts chewing on that tooth, that pulp will actually kind of recognize, hey, I'm getting more force than I should recede. I gotta back up a little bit. And so as that pulp starts backing up, we can come back like every 30 to 60 days and keep working that tooth back until it's a more normal height. So sometimes we have to see them pretty frequently for a very short period of time to get the tooth back to normal, and then we can go back to either seeing them once a year. Some horses that have significant disease that require every 6 months that we adjust them because they're either missing a tooth or things are not, normal, we'll see them more frequently. Reasons that you should call that are not necessarily within that like 12 or 6 month or established schedule are horses that are chewing abnormally. So some of the complaints I get are like, oh well, he picks up his hay and he kind of like doesn't necessarily chew it appropriately, but does this weird thing. And sorry, I'll do some weird facial science for you for the next 5 minutes. But horses that are quitting, so not quitting, Q-U-I-T-T, or T-T-I, I can't spell Q-U-I-T-T, but Q-U-I-D-D. So this is a quid. So a quid, we call them like hay cigars or hay balls. And so what happens is, that horse is trying to auger that bolus of food back in his mouth, the back of his mouth, and they're kind of intelligent, and they realize like, oh, I don't think this is the size I want to swallow, and they just go, Peh. And this is what you find in the horse's stall are these like balls of like semi-chewed hay that are just kind of sitting about. Those are like my favorite when I walk in. I'm listening to the horse's heart and I look down and I'm like, and then you start looking around and you're like, yeah. So how long has he been doing that? Doing what? the giant balls of hay. And they can be small. You can see down on the person's fingertips, they can be even little guys. I mean, the horses do have some degree of cognition, shockingly, that maybe they shouldn't swallow that because they're going to choke on it. And so they'll just literally pop it right back out of their mouth. A foul odor, it's my other favorite thing, as I'm like taking the horse's temperature and looking at his gums, you're like, kind of smells like someone left some hay cubes in a bucket for 6 weeks. You can smell that if there's feed packing where a tooth is either fractured or they have gaps between their teeth. That odor can be pretty apparent and pretty shocking. Horses that have sinus infections, that like kind of dead fish smell, it sticks with you for a long time. It's a little scarring. So those are reasons that we would want to see you sooner than the 12 months. Other reasons, so the reasons that we see these horses more frequently, we're going to kind of delve into quickly now. And I'll be honest with you, I could have given you this entire talk on just dental pathology. There is so much that can go wrong in horses' mouths, from just the like very slight changes to the giant tooth cracked in half hanging on by a thread that are quite obvious. And I've just touched on a couple common things so that if you hear some of these topics, you kind of know you've heard it before. But not all of them, as you'll kind of glean from this, not all of them necessarily need significant treatment, and not all of them need treatment right away, but a fair number of them do. And so again, this is the power of the oral exam. If I can identify some of these different things sooner, maybe we can avoid, catastrophe, or at least when catastrophe strikes, we knew about it, or we know to check this horse or whatever. It's important to really look at the entire mouth because they can have very, very small changes, and that's where if you're not using a mirror and getting back there and looking at the horse's gums, you're going to miss this stuff. And so it's important to understand kind of what not what we're looking at when we see these things. So I think the most common that we see are malocclusions. So back to your Latin roots, mal means bad, occlusion means the contact of the teeth. So this is when you have some kind of missed contact or inappropriate contact. So there's a couple of different categories. The most common that I see on probably a weekly basis are overgrowths or overwears. So you guys can see this horse on the right is doing his best Dracula impression. So this is that very front, go back to my pointer, this very front, this is actually a premolar, but the second premolar of this arcade has got this big hook of enamel and dentin hanging off the front of the tooth. And so these are often because the horses have abnormal conformation to their skull. So, you know, if anybody here breeds young horses or works with a lot of young horses, the reason that we're so critical of bite is because it has massive implications on the horse's dental anatomy. So if you know that this horse, the teeth erupt at 4 millimeters, 4 to 5 millimeters every year, which is like, you know, a little amount, then if you imagine measuring that hook has been going on for at least 3 years. And I won't publicly shame her, especially on Facebook. This is a friend of mine's horse that, you know, well, she's just an old brood mare, sits in the pasture, she doesn't need her teeth done. Probably does. So this has been let go for a little while, which gives us a nice photo demonstration for this talk. But obviously, this horse now is changing the way that she chews because she can't extend her lower jaw forward because the hook of that is just going to ram right into that lower molar and be uncomfortable. So this horse is now chewing more side to side, and she can't do that nice fluid figure 8 motion. And they'll also, when they have large overgrowths like this, it can contribute to other types of periodontal disease like overwear of the gum. And the lower arcades, so you'll notice a lot of my pictures are of the uppers because they're quite easy to photograph. The lowers are a little harder, but the tooth on the bottom of this jaw that was partnered with that one was overworn, and so it was missing a lot of crown that it should have had because this tooth has just been inappropriately rubbing on the front of the other one. This can also occur due to lost teeth, so if you know, older horses that either kick a tooth out because of age or if they have to have an extraction from something else, once you take away that other tooth's grinding partner, it's just going to keep erupting kind of uncontrolled. And so, oh, are you going to say something? Oh, I thought you were about to kick a question out.
No, I'm on the television.
Okay. So a lot of times we'll see, especially if I schedule you for an extraction at the clinic, on your discharge I write at the bottom, this horse will need sedated oral exam and odontoplasty every 12 months. Because then I get to come in kind of artificially and knock that tooth down and keep it at least level with the rest so that it's not like growing up and disrupting the socket of the tooth that we took out. Other things, if they change their chewing pattern, and lastly, not to sound prejudiced, but breeds. Minis and donkeys love to have abnormal dental anatomy. They got the same amount of teeth crammed in a tiny, tiny space. And so they will just have teeth everywhere that they shouldn't, and they'll grow tall. And then if I had a mini farm, like, they could be some of my best patients for you today because they have some of the weirdest mouths usually. But they love to grow big hooks and ramps like this. And same thing, we can stay on top of them. We just have to see those horses more frequently. So this is the exact same horse. I'll prove it to you. If you'll notice, there's a little dot of enamel staining right there. I checked this before I put this in there. It's still there. This is the same horse after I corrected it. So you'll see that what I did was essentially try to restore more of a normal, nice smooth contour to the front of the tooth and take it down as much as possible. You'll notice that it is not perfect, right? And this is where I like to educate my owners, because the last thing I want for you to do is not feel confident in what we did. And if you look at this, you'd be like, that tooth is still tall in the front. And I'd say, yeah, it sure is, because if I go any farther, I will kill that tooth. And so what I do when I'm doing large reductions, we have some standardized kind of measurements. Like, we know we can safely take off anywhere from 2 to 4 millimeters of tooth during a reduction. But what I do is take a step even further. I have a small little brush, it looks like a little toothbrush, and I gently brush the tooth as I take some enamel off, and I look at that pulp horn with my mirror and make sure that the pulp horn isn't changing, still looks happy, I'm not into the sensitive stuff or getting close. So in this horse, I actually took off more than, the 4 millimeters, but I was checking that pulp worn the entire time. And so that's where it comes in that, you know, it would be, and I do find myself every once in a while, the intrusive thoughts are like, just flatten it. You can't do that. So you have to know the anatomy and you have to understand why we do things the way we do. And correcting these can take time. And what I told her for this mare in particular is I said, hey, let me come back in 3 months. I'll have that baby normal by the fall. Like, you know, once I get it there, fine. I'll see her every 12 months. We'll know that she gets an overgrowth. If she starts to grow a little taller in the front, we can knock it down because by then it'll just be a millimeter or 2 and life goes on. And the next person that goes in her mouth may never know that she had that huge step. So you can get these guys pretty normal and keep them normal over time. This is an overwear, so this is an older horse, but you can see, back with my pointer, that this tooth has kind of a reversed cupped appearance. And you may be tempted to say, well, it looks like it's got a hook in the front, but if you'll notice, it's actually missing pretty much all of the normal crown. So this is an overwear. A lot of times this happens with older horses as they get to kind of the end of their tooth life. They'll not have the normal amounts of grinding surface, and so things just kind of get a little funky. But that's what some of those will look like. You can see down below that molar, this premolar sitting down here, is too tall. So that's why this is actually a real overwear, is that the bottom one had just been kind of doing too much to his friend up top. This is a mini donkey. So if you can see, lower teeth, there's no upper tooth there. It's a giant slope, and then we have these upper teeth and no lower teeth down here. So this donkey, he was eating just straight mush. And his teeth were actually so significant, like when I would open him with a speculum, I could not even get my dental instruments around the back of these upper teeth because they were just dropped so far down into his mouth. And this guy, I met him because he was having trouble eating. Like, they noticed that he was like leaving all of his hay in the stall, and they were worried he was losing weight. And I said, well, let's check his teeth, you know, easy rule out. And as I opened his mouth, I was like, Mother of God. So they don't know. He had to be in his 20s. Easy. Yeah, old guy. Yeah, old guy. But this is exactly what we try to avoid. So if you let these overgrowth horses go, nature will take its course and things will be worn away and things will overgrow, and then this is what you get. I cannot do much for this. Right? I cannot just like grind this donkey's teeth down into little river rocks and say, here you go. The problem with some of these older guys is once they have an abnormal mouth, if you start taking things away, now none of the teeth are touching. Not that this donkey has much teeth that are touching anyways, and this is where we say, okay, we're just going to modify the diet, but these are hard to manage. So this is where, you know, ounce of prevention, pound of cure is really worth its weight. Next little pathology are called diastema, or diastemata is the plural. So these are gaps between the teeth where the horses will get periodontal disease, which the periodontal tissue is the tissue surrounding the tooth, so the gums, the periodontal ligament, which holds the tooth in the socket, and then the socket itself, or the alveolus. So these are usually associated, we don't know why some horses get these, but we see it more in geriatric horses, or older horses. And we think the reason for that is as their teeth get to the end of their life, they're much shorter, and so as they get short, they lose their nice long anchoring system, and so they'll start to drift. And if these horses develop enamel points where they're chewing differently, they start packing their feed. The reason I use this picture, which is not one that I took, but that green grass is like a highlighter between those two teeth. You can see exactly where that diastema is. And a lot of times I'll open horses' mouths, and it is just like that, where I've got clear as day where I'm looking, that there's feed packed in there, the gums are all bleeding, and they've recessed away from the tooth. Or they can be as slight as I'm doing my mirror exam, I notice there's some grass kind of around the root of a tooth, and I have this cute little, I call him Captain Hook. He's just a cute little hook, and I'll go in there and kind of clean it up, and then I see that there's just the world's tiniest little diastema. And again, those are ones I'd rather see because I can treat them when they're small so that they don't get to this. But this is a lot of times what can happen. These are painful. So if you, like, we all had a bowl of popcorn here where you got that one kernel kernel stuck between your tooth. A kernel is just a thin little sliver. Imagine packing like, you know, a centimeter worth of grass in between your teeth. It's not the most comfortable thing in the world. As the gums start to recede, they can become painful, and they can even so much as spread the teeth wide enough apart that they loosen the tooth, stuff food, bacteria, tracks down the side of the tooth, causes a tooth root infection, and the tooth has to come out. So these have a wide range of how serious or how involved they can be, but they're there. They can be open like a channel, so this is an open diastema. It's the same width all the way down the tooth, or they can be a valve, where the surface of the tooth or the occlusal surface is actually still touching, but up by the gum it's wider. Those are harder to treat because then once they pack stuff in there, they just sit. We can actually do a procedure called a diastema widening, where we take this little tiny cylindrical burr and actually turn those into open diastema so the stuff can just come and go. So it kind of depends. The treatment of these, there's hundreds of different things you can do to treat diastema, and if any of you have like questions about, I can go into that in a more personal time, because again, I could probably give you an hour-long talk on just diastema, but that's a very common thing. Fracture is another one. This is a great photo. Open the horse's mouth, tooth split in half. Boom. It's pretty easy. They can be as simple as what we call corner fractures, meaning just a little bit of enamel has been chipped off of the side of one of the teeth. They can have slab fractures, where essentially they'll just like fracture down like the long side of the tooth. And everyone, when they hear fractured teeth, they kind of get this moment of panic. Not all fractured teeth involve the sensitive structures of the tooth, and we don't do anything for those. My favorite is when I find a corner fracture, it's just a little chip of some enamel, and I say, hey, your horse has a corner fracture, but who cares? The horse just has a tiny chip of enamel. We're just going to monitor it and move on with our lives. So you don't necessarily have to, over time, treat these guys, but if they involve the sensitive pulps, you do. Fractures where the teeth are mobile, if stuff has tracked up the tooth itself and the tooth become infected, or if they have other comorbidities, like a lot of periodontal disease, or if the horses are, you know, we're noticing performance stuff. A lot of times those teeth do just have to be extracted, but sometimes not. And then finally, what everyone I think is really afraid of, the old tooth root abscess. So you can see in this x-ray, and I think this is helpful, especially if you think back to about the diastema, the back molar, or the 11 tooth, and then the front premolar, or the 06 tooth, are angled in slightly, and so the horse's teeth actually hold themselves all within the arcade. And so this is important part of anatomy too, but these guys, tooth root abscesses are kind of this insidious thing that can happen for a variety of reasons, but usually it's that the tooth has either a very large fracture or a very small fracture. They can get what are called fissure fractures, which are like cracks, where then stuff can track up the tooth itself. And those bacteria, when they hit the root of the tooth, they're like, wow, look at this nice little penthouse. It's quiet, it's dark, there's a pocket here, there's a blood supply. Sometimes they stuff some hay in here for me to eat. And they just set up shop. And once they start, they don't go away. And so also, because we're all anatomists now, master anatomists, does anyone know, I'm trying to think how I can lead you there. Does anybody know what one of the more common signs of a tooth root abscess are for these teeth in the back of the horse's mouth? Yeah, nasal discharge. So why do you think that is? Does anyone know? Why does it fill their sinus? You're there.
Yeah, because the sinus is right above the teeth.
The sinus is literally not just right there, it is there. So these tooth roots, if you look, and actually what I'm going to do now is zoom in, these tooth roots that are sitting of these, usually it's the back three, so the 9, 10, and 11, but these tooth roots are sitting literally, the floor of the sinus is the alveolus. Like they are the same piece of bone. And so the second that those bacteria set up shop and some of that bone becomes unhealthy, they go, cool, this penthouse has a rooftop bar. And all of a sudden they're gone. And the sinus, just like yours and my sinuses, especially mine this week, it's literally just a big cave. And it's got a lining of cells, and air comes in and air goes out, and that's it. It doesn't have a great blood supply, because obviously it's just a dead space. It doesn't have a robust access to the immune system. So once those bacteria set up shop in the sinus, they're there to stay. And they can be really pesky, especially if you don't don't deal with the root of the problem. So anytime I have a horse, especially if the nasal discharge is only coming from one nostril, the very first thing that I rule out is a tooth root abscess. Now I've given you a hint, right? I've used this set of x-rays for a reason. This horse has a tooth root abscess. Can anyone see it?
Is it the cloud above the middle tooth between the two?
This one?
Oh, I was looking
This
at that
one?
one. I'm looking at the tooth. Never mind. I'm in the wrong spot.
It's okay. Cloud is a good word. I thought you were there because it is this cloud here. So if you look, and I'm going to zoom in even more for you, you can see, like, let's use this tooth for example because it's very easy to see. So this tooth has two roots that come up, and you can see that nice, very thin black line surrounding it. That's the periodontal ligament in the horse's socket. And then you can see the bone around it is a nice white bone with the black air of the sinus behind it. This tooth, you can see those roots are like little nubs. They've been blunted. We've got a big wide halo of black surrounding those tooth roots. So we've got widening of the alveolus with air packed into the alveolus, and then all the bone underneath it has turned bright white or sclerotic, so it's an inflamed bone. This is like, I told this owner when I took these x-rays, I said, this tooth root abscess could go in a textbook. This is like perfect. Perfect imagery. The horse had a very mild, intermittent left-sided nasal discharge. She had a corner fracture of that tooth that involved the pulp horn, like on the surface. And I said, hey, you know, that either it became open, it was open when it fractured, it became open, stuff tracked up, the horse has a tooth root abscess, that's got to go. Unfortunately, because of the anatomy and because that tooth is abnormal, that tooth is just a petri dish. So if you try to blitz these with antibiotics, which is like our first, gut reaction to infection, it will just come right back. So often what I get is you start the horse on some SMZs because everyone's got them in the barn, snot goes away, life is good, SMZs in 2 weeks finish, snot comes back. So these are pretty predictable, and that's why, like, even though the tooth is mostly normal, we take these out. That tooth's just going to continue to be a problem. And the horse only has mild nasal discharge now. If you let this go, it will just take off like a rocket, and if the horse gets a massive sinusitis where just that nasty snot's pouring out of the horse's face, once the sinus lining has enough damage to it, even if you take the tooth out, the chronic sinusitis can stay. So that's why I try to get these early, because once they have massive damage to the sinus, it's really hard to come back around from that. Finally, we haven't talked a lot about incisors because for the average, dental, they're kind of not very exciting, I check in on incisors. Obviously, we look at them as part of the oral exam. Most of them are pretty boring. Occasionally, there's some enamel that we have to address, but one of the big conditions that a lot of people are becoming familiar with is EOTRH. And so this is a disease of older horses. It stands for equine odontoclastic tooth resorption and hypercementosis, which is essentially just a big fancy way of saying that the body will sometimes attack these teeth and absorb parts of the tooth, and sometimes we'll lay down extra cementum around the tooth itself. So this is an x-ray that shows a little bit of both of that. So you can see, like, this tooth here has got a big bulbous root with a big black circle in the middle. That's the resorption. Whereas these teeth here in the middle just have big white bulbous roots. That's the hypercementosis. So it lays down too much cementum around the tooth. This disease was identified multiple years ago, but we still don't quite understand why it does what it does. So I kind of explain to owners that it's almost like an autoimmune disease where the body attacks the roots of those incisors, but we don't know why it does what it does. The unfortunate thing is there's really no way to treat it. Lots of people, because this is a fairly common disease, especially as you all get better at taking care of your horses, they live to be older, and we're taking better care of them, so they get to meet me for their dentals, and I catch this. A lot of these horses, people have tried all sorts of things. They've tried medications to stop the bony turnover, because it's so painful as these teeth get ginormous in those sockets and they push on everything. You guys probably can't necessarily see this unless you happen to be a connoisseur of equine radiography, but this mandible is super angry. Like, all of this bone that's like this really woven kind of pattern, that's a really irritated bone. This is a very painful disease. I cannot give these guys enough pain meds to make them comfortable. So it's not like a little hock arthritis where sometimes you can kind of hump them through. Like, these guys are painful. If you've done any reading on this disease, you probably heard of the carrot test. So if you hold a carrot out, will your horse bite down on on the carrot and crunch it. Horses that have significant incisor pain sometimes will not. Sometimes they will. My own personal horse will eat a carrot through his own death, I think. So it's not 100%, but it was something easy enough to do. But the treatment for this is actually just to take all of the horse's teeth out, which seems kind of aggressive, and it is. It's obviously an invasive surgery, but I have a list of clients on my phone that when I'm recommending this to someone, I say, listen, don't take it from me, call this person, and they call them, and the clients say, like, I got my horse back. Like, I had no idea how painful their mouth was, and I did it. I took all 12 teeth out, and all of a sudden, my horse is back to himself. So I think that sometimes, especially this disease, does not just happen overnight. I mean, this has been going on for years, and I think we kind of miss some of those subtle changes, and then when you do this, it's incredible. The way the horses heal really quickly, they don't need their front teeth to eat, and the fact that they're then comfortable and happy again, to me, is the biggest part. This is a picture of a post-operative horse. So this horse had significant EOTRH. You can see, like, we already were missing some teeth. They probably, with the resorption, just cracked and fell off. And then we've got, like, the lumpy, bumpy gums. We've got the gingival recession. This is him after we took his incisors out, so they end up looking kind of like a goat. They just, obviously, minus the lower teeth, but they just don't have any incisors. They learn to eat grass and pick up hay with their lips and tongue. We don't change their diet. I don't even change their diet the day I take their teeth out. Once the block wears off and they're eating hay, I give them the same thing they got that morning. So these horses do really well, and you take away their oral pain. Did you have a question?
Well, I was going to say, is this same disease related to cats, with resorption in cats, where they have to take the teeth with cats?
Yeah, it is. We don't necessarily know, like, pathogenically if it's the same. She had asked for the people on Facebook if it's the same as resorption in cats. There is a resorptive disease in cats too, and yes, those often will cause similar characteristics beginning to end. So just to kind of wrap things up here, I just have a few common myths. And so myth number one is about power tools. You know, I talk to some owners that are like, I don't want power tools, I want hand tools. I'm like, I hear you. I am a ripe 30 years old. I've already had both rotator cuffs worked on. Equine dentistry is hard work. Power tools, when used correctly, are safe tools for equine dentistry. I float probably thousands of horses a year, maybe not like thousands, but at least 1,000, I would say. And those horses all live to eat fine. Like, when you use them appropriately, power tools are okay. I think just like anything, I mean, everyone here, we're all here because we like horses. You guys have probably heard about bits. People are like, a shank bit is the worst thing in the world, or, you know, a broken snaffle. It's the same thing. If you use a tool inappropriately, it can be a cruel and horrible tool. But if you know how to use it and you use it correctly, they are safe and effective. I tell people, you know, half of the reason I passed around those hand floats is I wanted you to put your hands on them. How would you like that carbide burr going across your gums? Not so much. So if that tool, I don't have, because it's large, sometimes I don't have very much control of exactly what I'm floating, especially if, you know, I've seen some people float where the horse is not in a speculum where their mouth is open. They just pass the hand float in and float based on feel. If that flips up the side and goes, it will abrade their gum. It's not specific. It doesn't just say, well, I only work on dental material. Me personally, when I was trained in my internship, my mentor used hand floats, and so I was trained to use hand floats. I can use a hand float. It kills me because I physically have to do this the whole time, and it's not great. And on top of that, it's more comfortable for the horses. With my power tools, I can be in and out of a horse's mouth for a basic float in less than 10 minutes, and because they're fast and they're effective. So that's less time the horse has to be with their mouth open. That's less time they have to be on a headstand and a halter. That's less time that I'm physically working on the teeth and causing thermal damage and other things. So again, it's just something where you've got to know your tools, you've got to know how to use them. But from an owner's perspective, if you're using someone like me that you know and trust, then you can be confident that those tools are not harming your horse. It also depends on experience. So when I get little vet students in my truck that have never used the power floats before, yeah, you know, we're kind of backing down and I'm explaining to them that they can only work on so many things at once. But that power float, I'll tell you right now, is an extension of my own very arms. Like, I know where it is and what it's doing at all times. So I think that's really important. Number 2 is about minis and donkeys, so I decided to pick on them just a little bit. This is me floating this little mini's teeth. So we have specialized equipment just for the minis. They have their own speculum. We have different float heads, so you guys saw my power tools. This is actually my mini float, so it's this little tiny little barrel. It fits in their mouth, and I can get to the back of their mouth without like having to cram my giant float down there. So these guys, they are the poster children for dental abnormalities. They get horrific teeth very quickly. Like, some of the worst dentals I've probably ever done have been in young mini horses. They should be done at least once a year. So once we get a hold of them, if they're easy enough, then fine. They can be on the schedule with everybody else. So they're not always terrible, but I do pick on them a little bit because they do get some pretty bad disease. I also want to point out that, again, got to have somebody who knows what they want. Dr. Wrangle here making it work for her little mini. I always kind of pick on Dr. Wrangle a little bit because she's a little shorter than I am. So if I'm doing mini dentals, I have to like lay on the ground and like kind of get down as short as I can. But like this guy, he actually came in for a tooth extraction, and so we knew he was going to have his head up for a little longer than just like your average dental. So this is what we did to try to make him more comfortable. So this is our surgery bed, and then we put little plastic mats on it so he could stand and be up there and not have to have his head cranked up real high. So it's just a little plug. Dr. Wrangle's the best. Number 3 is my older horse doesn't have any teeth left, so he doesn't need a dental. Sometimes, I'll be honest with you, that is true. I have a couple patients where we've got to the end of that horse's dental life, and they're just kind of flat river rocks in there, and so I say, hey, like, we can check in every other year or something and just make sure nothing's wiggling, falling, cracking, crumbling, but I'm not going to float much, or if I do, it might be just one quick whiz somewhere. That being said, there are some of these older guys that, because the teeth are no longer normal and they're not chewing normally, they also get some very weird stuff. On the right here is a picture of a collection of molars. You can tell this is an older horse because they're all very short, right? This horse came to me because the owner said, you know, she's lost a ton of weight. She's just not thriving. And I said, okay, when was the last time she had her teeth done? Well, it's been a couple years now. Let's do her teeth. So there I am, sitting at the horse. I open her mouth, I pick her up, I look in, and the teeth are all there, and they all look okay, and I'm doing my mirror exam, and everything looks okay, and then I get my float out, and I put it on my first molar, and I squeeze the trigger, and it goes to buzz, and all of a sudden everything starts vibrating, and everything's wiggling. I was like, oh. So I said to her, I said, you know, and I had just at that point maybe touched one tooth, and I said, you know, this tooth is loose. She said, okay, well, what should we do? And I was like, well, it's an old tooth. It's probably not got much in there. We'll just take it out because it's not going to, you know, grow back and stick around. So I literally, in I think about 2 seconds, plopped the tooth out and handed it to her. I said, here you go. She's like, thanks. So I said, okay, back we go. So I go back, I get my float in, I go to the next one, and as I buzz the trigger, the tooth literally falls out of the horse's mouth. And so this was the saga of the next 30 minutes of this horse. That is all from one horse. 8 molars just fell out of this horse's mouth. And I'm not joking when I say, like, an average molar extraction takes me anywhere from 2 to 4 hours. These came out in 6 minutes. Like, they literally just fell out. And I think what was happening is they were all holding each other in, but the second one came, they all just went they were all from the same arcade, so this is a mix of both the left and the right, but this horse had such significant disease that they just all came out. This is on the farm, like this was while I was there. You'll notice that pretty much all of these teeth have no ligament attached to them, there's no gum attached to them, these were literally just sitting in the horse's mouth, held in by nothing. So even though it may be tempting to be like, oh, this is an older horse, they don't need much, you know, we still have to check in on these guys, and it may be the fastest float of my life if I'm just knocking, you know, one little ridge here or there, but at least then we can say, hey, we've done this oral exam, we know what's going on in here, and we can kind of move on. These guys also love to get diastema, like we talked about, as the teeth start to drift when they pack stuff in. They can be painful. I don't know how this feels, but I can imagine a horse would not love to live with rotting feed packed between their teeth. So we go in, we clean all that out just to try to keep these guys comfortable and feeling their best. Probably the biggest reason to do a senior horse dental is if I open your old horse's mouth and I say, hey, your horse has very little grinding surface left, you know, the biggest thing we're talking about that day is diet. Like, I may close the horse's mouth right there and we're on to the diet speech. You know, luckily, if you guys walk back to the feed aisle here, being a horse owner in 2024 is cool because there is a feed product for anything and everything that you could want to accomplish. So fulfilling a horse's fiber requirements and caloric requirements is super easy. You just have to know what to feed them. So these guys with no teeth left can't eat full stem hay, right? How big does it have to be in the colon? Yeah, an inch, half an inch to an inch long. If they can't chew that piece of hay down, it's doing nothing for them. You're throwing away your now $10 a bale hay, and the horse is getting nothing. They're losing weight. They're withering away right in front of you. I have 35-year-old horses that have not a single tooth left in their mouth that look better than some of my performance sport horses because we're feeding them right. So you can keep them around. It becomes intensive management-wise. I won't lie to you. I've owned horses my whole life. No one likes making mashes in about January 15th in Northeast Ohio, but you can do it. Then finally, and I know this is probably a burning question in everyone's mind. I don't really want to get into it, but if you want to talk about it, we can. You know, people say vets don't get training in dentistry, and vets don't like dentistry, and vets can't do dentistry, and I'm here to tell you that that's not true. I'm very passionate about dentistry. As you can tell, I could probably stay up here for another hour and give you more information, but it comes down to personal preference and training. I was very lucky. I attended Ohio State. I graduated in 2020. I was trained by a group of board-certified equine dentists that are based out of Newark, Ohio, Equine Vet Dental Services. Shout out to them if they're watching. They're great. But that group of people, you know, that they are veterinarians that are only trained in, they're not only trained, but only practice dentistry. They taught me so much about horses' teeth, and I can still call them to this day and say, hey, I found something new I'd never seen before. But if you don't have the training, and as you kind of glean from this, dentistry is very physical. It takes a lot of, you know, just energy to do. If you don't like it, it's not for you. The vets in our practice that don't do dentistry, and we love that for them because, you know, it's just not their passion. But if you are trained in dentistry and know how to perform it appropriately, it's a great thing to connect with owners, and I can fix problems for people that give them the horse that they had back, and that's what I love about it. And it's instant gratification, right? We all love that. Points be gone. But it's something that you just have to know your care team. That's all I'm going to say. So find somebody that you trust, and find somebody that you trust in their skill set. But some of us really do love dentistry, and you know, some of us I like to think are semi-decent at dentistry, so that's just my little plug on that front. So this is my technician, Kiernan. If you know me, you know her. She's with me almost every day. But she's a huge part of being successful in dentistry. She's kind of my patient manager. But I just want to say thank you guys for coming and listening to me talk. This is always so much fun to do at Big D's. We love coming here, and all the other doctors from our clinic that have come. Appreciate you guys always showing up. And I hope you guys learned something new today. So thank you. We've got the... we're going to take some questions. So we've got one eager hand. No dumb questions. She asked if horses get cavities. So the answer is yes. I didn't include it in this talk because, again, I could probably give you an hour talk on cavities. So there are cavities, and I'll go back to a picture because it's probably the most explanatory. So their cavities, they don't get cavities like you and I that are like because of high sugar in the diet. They can, but they don't typically. Usually when these guys get cavities, it's because some of the layers of the tooth didn't form correctly. So these guys almost always get what are called infundibular caries. The infundibulum, it's only on the top set of cheek teeth, so not on the bottom, but these like lighter gray kind of U's that are in the middle of all these teeth, those are the infundibulum, and if they're not formed correctly, exactly when the horse is literally growing their teeth, or if they, become diseased over time, they'll get cavities there. And this is often why, like when I showed that fractured tooth picture, if those both get cavities in them and the middle of the tooth get weak and it cracks, it just splits right down the middle. They can get peripheral cavities of the enamel, so like they'll get cavities like up here along like the gingival borders. And if I'm seeing those, then I'm like, hey, what is your horse eating? Like maybe we need to cut down some of the non-structural carbohydrates or something like that. But those are far less common. Yeah, great question. Thank you.
Will those resolve on their own?
Which?
The cavities up by the gums?
They can, because, like, again, our average dental is a year. So if I come and this is what your horse looks like, no peripheral caries, because this isn't a carie, right? This is just a normal staining. And if I see that, and, like, this is 2024, and I come back next year and all of a sudden the horse has cavities, I don't know if it's because, like, maybe they got into some hay that was higher in sugar or something. So it's not necessarily that they resolve on their own. It's because the tooth grows out, and then they get worn away, and now they're just gone. If that makes sense. They get worn away. So kind of. Yeah.
I have a rescue horse that has a cleft palate, and I've been a little bit leery about having her teeth floated. She has a soft palate cleft, and so I've just been worried about any debris possibly going in that direction with the power. I mean, I guess the power tools aren't spinning, so that's kind of good. But I was concerned about that. Should I be concerned?
So, like, if the concern is, well, number one is, I guess, if we're worried about contamination into the airway, like when I'm doing even a normal horse's float, like, it does, as that tool is grinding away the tooth, it does break it into small pieces and become aerosolized. Like, if you ever see me do a dental, you're like, oh, the mouth is smoking. It's not smoke, it's enamel dust. Yeah. That could go down their airway just as they inhale during their float, and we don't, like, there are problems with long-term exposure to aerosolized dental material, but we don't know, like, we don't recognize any issues with just like a single incidence. If you're worried about that, like, contaminating their esophagus or eating it, these old horses, yeah.
I'm just sort of like worried about her airway, and she's quite snotty, sort of like whatever she eats, it's like she's eating hay, if she's eating pellets.
Yeah, because it's just coming out in the nasal passage. Yeah. So
pretty much out of one side or the other, but both sides.
Yeah. So it wouldn't stop me from doing her dental. What I might do is like go an arcade at a time and just rinse her so that all of that material is rinsed back out. And maybe when I'm doing her initial rinse, because part of once we get them sedated in a speculum, we rinse their mouth, get all the feed out. I might just rinse her a little less aggressively, but it wouldn't stop me from doing her teeth.
Okay, because I was concerned about having it done. I had cleft palate surgery, which was not successful, and they said that her teeth was just like a little bit. She had like a little bit of some points there.
Yeah.
They said it wasn't horrible. That was last August.
Yeah.
So I'm thinking, well, I don't want to wait for, in real wrong, but I wanted her to, she's healed and she's settled and everything.
Yeah.
But I just didn't know what to do about
Yeah. It wouldn't stop me from doing her teeth. And maybe she's one that if we're just trying to reduce how much we have to do that, because like, the flushing of her mouth and stuff, if it goes through her defect, maybe she's one that we just kind of check and do as needed.
That's a little bit of an overbite. And so I think sure there's probably more defects that I'm not investigating.
Yeah.
And I've had trouble keeping getting weight on her. So I'm actually increasing.
Another check to do the teeth.
I put alfalfa pellets now with her feet, and she appears to be gaining some weight now. But it's like she's just been so difficult.
Yeah.
I think that's the root of some of her problems. But I don't want her teeth to be delayed.
Sure. Yeah, I would do them.
Okay.
I know you've been waiting.
My question is, one, do you have business cards? And two, have you ever worked on a horse that you've maximized the sedation medication to where you can't give them anything and they're not cooperative still?
Yeah. Yes, I have cards too. Yes, there are some horses that like I've had to give pretty big slugs of drugs and they're still like not participating. I will say I am a little more adventurous with my drug use. It was pretty standard for most horses to use dilmosudin and torbigesic, so a sedation and an opioid. I will, for the horses, combo in midazolam, which is a muscle relaxer, and ketamine. So at low doses, it doesn't produce general anesthesia, so we can just dissociate them. So there are other kind of protocols you can use to try to use different chemistry medications. But there are some horses that just give me the stank eye the whole time.
I have a horse, and it literally takes probably 3 people. In the beginning, he starts out okay for like the first couple minutes.
Yeah.
And then he just, no matter whether he's in the headstand or the rope, he's able to be totally conscious and control of his body, no matter how doped up he is. And he just brings that whole neck and head down. I mean, and I've had different people do them, and it's not the people, it's him. He's gotten to a point in his life where he's like, I'm not doing this. You can't make me do this. I'm going to let you know you can. And then when we're done with him, he's barely standing.
Oh, yeah, because then you stop stimulating them and they're drunk.
And 2 people on each side to get them, And it's just like, at some point I feel I can't do dentals on him.
Yeah.
Because, like I'll tell the people, I say he gets dangerous, and I don't want anybody to get hurt. So at any point, we can stop the show.
Yeah.
But if something happens to where he injures himself with that speculum, he does something totally, I'm going to be making the choice to have him euthanized, unfortunately.
Yeah.
Because I can't, he's 25 now, and he's still doing this.
Yeah, those are the horses I try some alternate. Like I maybe go for the ketamine for a dental like twice a year, but I do have some horses where we have to figure out what their magic cocktail is. Luckily,
we save him for last, and I always warn the people. I say everybody else is normal.
Yeah.
This guy's not. This guy's complicated. Oh no, we've done complicated, no problem. And everybody has cut his dental time short. Like they weren't able to finish what they had on their game plan from their exam.
Yeah.
They're like, I couldn't get to that.
Yeah.
And so that's why I was asking.
Yeah.
Is that
and I will
thing in the dentistry? Well, I got an oddball.
No, especially in the older guys, we love to say they get body drunk and brain awake, because that's exactly what you do. Is you've got to increase your sedation because they're mentally like, no way, Jose, but body wise, you're like, if I give you any more drugs, you'll lay down. And it's just like they can be tough, truly. And that's where I've gotten a little bit more not experimental. They've established things, but I will, on some of these guys that I have documented like issues with sedation, like I've got a couple tricks up my sleeve of different protocols I'll use and different meds, and sometimes it still doesn't work and we just make a plan, but yeah, it happens.
Can get done.
Yeah.
Totally stupid.
Yeah, or sometimes
people on them. It's like
it's not a good situation. Yeah, I have one horse that he's about the same way, and so what we do is we give him enough drugs that I can get it done. I do his top teeth, and then I would come back a month later and do it again, just to his bottom teeth. Because he's the same way. I get like 10 minutes where he's like, all right, I'll play along, and then we're done.
Wake up and it's like. And it doesn't matter. He brings that head to his chest, and if your arm's in there, he's going to break your arm.
Yeah. So yes, I've got tricks, but they're just that. They're tricks. Yeah. Yes.
Can you suggest anything that we can do as horse owners in between like the 1 year, like the 12 months that, like with dogs, you can buy dog teeth, toothbrush or dental toothpaste, or something that where we can even look as not an expert, but to say, to see anything or any preventative for horse dental.
Yeah. Her question was between yearly floats, preventatives for dental care, and like identifying when care is needed or kind of when stuff is happening. I think for me the good news is like, unlike dogs, like these guys don't really get dental tartar. They can, but it's not the same where it's going to contribute long term to like the teeth needing to be removed. And again, that's because of the constant eruption. We don't necessarily clean any part of their teeth, like except for the diastemas where I have special tools that will dig the food out and stuff. But realistically, like very little really needs done between floats. Where for me it's more important is if I'm coming, I do a horse, and then we come 12 months later, and the horse has significant pathology by that 12 months, then instead I'm saying, hey, let's do an 8-month interval next year and see if, because 12 months is just a recommendation, because all the things that we kind of work with are usually just anatomical. So like you don't want to buy a hand float and go in and like float your horse every couple months, but like you don't necessarily have to do much, if that makes sense. Like dogs and cats, because their dental anatomy is different, you do have to be a little bit more preventative minded. But
like we had a chinchilla that their teeth constantly grew, and you always had to give them wood to chew on, or there's no type of block or anything or supplement or anything for horse teeth health as a consumer.
No, and they haven't, like, these guys, because of their dental anatomy, they grind their own teeth pretty effectively. Like, especially with, like, your small herbivores, like the guinea pigs and stuff, the wear that you're worried about mostly is, like, the incisors, and so that's why they have to do the chewing to keep their incisor length down. These guys keep their molar length down by chewing on themselves. And then, like, for horses that are, like have issues where something's overgrowing, I think even if you fed them something, one, I'd be afraid if you gave a horse a wood block, they'd try to eat it and choke and die because they're horses. But two, I don't think that you would get it to a spot where they would chew that targetedly enough to address a single problem. The biggest thing that I see that I kind of manage preemptively is the non-structural carbohydrates. So if horses have significant cavities, then I'm decreasing their starches and sugars, which you can do with a lot of like feed changes. But other than that, you really don't need like preventative stuff.
One other question: if you notice a horse kind of chewing to the side, is that a dropping food? Is that like a clue that there's something going on?
Yeah, she asked about horses chewing the side and dropping feed. Number one is, I meant to put this in this presentation, I didn't. Some horses will just drop grain behaviorally. Like, no matter, I could float that horse's teeth to the gums and they will just all drop my feed. Because that is one thing where, like, people will call me out for floats, and I float the horse, and the horse has normal teeth, but then they call me, they're like, well, he's still dropping grain. I'm like, okay, like, I don't really mind that, really. And I think some of these guys, if they just bolt feed and they don't care, then they're not that careful, truly. But yes, the chewing thing especially can be a sign. So pretty commonly, and I won't lie to you and say that I've opened a horse's mouth that someone's reported that to me and I can't find anything wrong, but some of this time, like, we will start to see that where all of a sudden it's a sudden change, and you go in and the horse has like a fracture or something, and they're chewing because they're trying to keep stuff away from that because it hurts. The other thing, and we didn't talk about this because again it would have been way just too much, is obviously the teeth are just one part. You've got the TMJ, you've got the tongue, you've got all the other parts of the horse's masticatory system that can also have issues that would preclude that. So like I have a horse that I work on that has true TMJ arthritis. I think everyone loves to be like, it's the TMJ. But it has true TMJ arthritis, and that horse does chew abnormally because he has a mechanical dysfunction, right? Like the joint just does not do what it should. So yeah, he does kind of chew side to side, and like will do this weird thing with his head where he like rocks back and forth. And we know why because we've diagnosed his TMJ, but yeah, it can change that too.
One more.
Yeah.
Other than like Google search, how do you find equine dentists that, because I've had somebody come out before and said, oh yeah, I can float teeth. Obviously not an equine dentist. Is there like a certain place that you can?
Okay, this is what I didn't want to talk about. We'll do it though, because it's kind of a touchy topic. But according to the Ohio Code of Veterinary Medicine, the laws of the state of Ohio, dentistry is an active veterinary medicine. Okay, I think in Pennsylvania it's the same, and it does vary state to state. For example, like in Texas, it's not. So like we say lay floaters, people that are not veterinarians that do dentistry. In this state and in Pennsylvania, you have to be a veterinarian to perform dentistry according to the law. You also have to be a veterinarian according to the law to sedate horses. So if you're doing either of those things and you're not a veterinarian, it's technically against the law. Floating teeth is not rocket science. I can teach probably all of you here to float teeth appropriately if you spend enough time doing it. And so I recognize that there are people that are not veterinarians that perform floats, and that's where I'm kind of just because I don't really want to get into the ethics of that or whatever, but what I always recommend is talking to your vet about the dentals, because your vet may be one of these people like me that loves dentistry and be like, I'm happy to do your dentals and I can do a good job for you. There may be a person who says like, yeah, I can do teeth, but it's not my favorite thing, I can offer to you. Then say, then who do you recommend? And if they have someone that they recommend, then that's how it would go through. There's really, like, aside from those resources, like, to be called a dentist, and this is really a phonetical thing, so forgive me for going down this rabbit hole. To be called a dentist, you have to be someone who's boarded in dentistry. I am not boarded in dentistry, therefore I am not a dentist. I am an equine veterinarian that does dentistry. It's a word game, right? But there's not a single resource where you can kind of go and like look up like what vets do dentals and like them. So you kind of just have to ask around and talk to people who are local. I don't know, and like if you wanted from this for me personally, like I don't know of anyone in like the PA side of things, but like I have people that I could call to find out who does dentals in Pennsylvania that would do a good job. But yeah, I always tell people to talk to your vet first. It's like, if you see Dr. Allison in our practice, for example, he doesn't do dentistry, but he'll be like, oh yeah, go talk to Dr. Johnson, Wrangler, or Sabo, they love teeth, and they'll do good teeth for you. So, yeah, that's what I would recommend.
One quick question.
Yeah.
Please, in regards to sedation, I know that there's amounts, varying from horse to horse, and then once they've so-called recovered, time element before you start offering the feed again, because that's not a good idea for them to try to eat while they're kind of not able. Do you have a recommended time period?
The biggest thing is that I want them to have control of their tongue, one, so that they are chewing appropriately and swallowing, because the biggest risk is choke, because they will get, I call it the drunk munchies, where they just sedated them and they're like, hey, and you're like, why? But so I usually tell people about an hour, like with Dormosidane, the length of sedation is about 45 minutes, so round up to whole numbers. I have some horses that like I finish their dental and they're like, hey, I'm wide awake, and you're like, well, I guess I give them 10 minutes and they can eat. So it just kind of depends on the horses. Horses, everything's an average, so if they metabolize the drug slower and they stay sedated for longer, or if they metabolize them faster and they wake up quite quickly, it'll change that recommendation. So obviously I'm usually, as the vet, not hanging out until the horse is awake, so I look at you and say like, yeah, I say, hey, when they're bright-eyed, bushy-tailed and you'd be comfortable, you can feed them. Yeah, and it is abnormal. Like a horse should be able to go from dental to food. If the horse is like, you finish the teeth and they don't want to eat or they're having trouble eating, that's abnormal. So I get that sometimes. They're like, the dentist said they won't eat right for 2 days. I'm like, that's a red flag. So yeah.
Thank you.
Yeah, no problem.
Thank you very much.
Yeah.
Awesome
Thanks.
presentation.
Thank you. Thank you. Yeah.
How do wild horses survive without having their teeth?
They have horrible mouths.